Usually we have two warehouses in one. This side we do mostly program commodities. The other side we do essential medicines and medical supplies that we call KEMSA Capital, procured using our resources. We do supply to all the 47 counties. The counties are required to place the order using a system that we're going to show you when we get to the other side, called LMIS. They are able to virtually see our warehouse. They are able to generate their own pro forma invoice. Then they are able to prepare LPO. And nowadays we insist on if-is generated LPO to ensure that the funds are locked, to avoid a lot of issues to do with debt collection. And then once they give us the LPO, they will submit the order through the system again. And then the order will be taken to our customer service. Our customer service will process that order, doing what we call DQA, data quality analysis, to ensure that the part sizes are correct. There are no anomalies in terms of the quantities. Sometimes some people think it's a single product with no pack size. So we check all those. Then the order is sent to the warehouse for picking. You're going to see that. Once the order is picked, it's taken to our distribution department. The distribution department will prepare a document called delivery note, which the counties will counter-check with the physical product once it's delivered and do last mile delivery to the point of use. So here, Madam, here, we have some officers who will explain the process in a nutshell. So this is Jackie Maina, she's the National Sales Manager. So she'll explain how the order comes to us.
Good afternoon. Yes, karibu KEMSA. Good afternoon, the board directors, the board chair. I'm going to briefly explain to you how we get orders from our county customers to KEMSA. All our orders are processed through logistics management information system, which we call LMS. So there is no order that comes to KEMSA through paperwork. All our orders are processed virtually through our online system. And our county customers have visibility of our virtual warehouse. They are able to see what products we have in stock, what quantities, and the prices for those products. They upload their orders starting from the lowest level of the facility, from the dispensary, the health centers, to the hospital level, and then they consolidate all the orders to the county level. And then we get the county orders forwarded to KEMSA, still through the LMI system. And once the orders are with us, our customers can also see and track the orders as they go through our chain, from when the order comes to credit check approvals to warehouse processing up until the order gets shipped to the customers. So we are very happy that we have the online system. It's supporting our inventory mechanisms. We are able to track and reorder based on the customer's demand. And once the order gets to KEMSA, then we process it from sales and marketing and forward it to customer service for processing.
Excellent. Thank you, Jackie. This quarter we've done orders worth about 1.3 billion, Madam CS. This month we have done orders worth about 483 million for the facilities basically, and those are not program orders. Those are the KEMSA capital orders. So shall we work? And we'll be flagging off commodities worth about 150 million for specific counties that we'll mention as we go along. So Ismahan, if you don't mind, take us through customer service.
Good afternoon, everyone. My name is Ismahan Suleiman. I am at customer service. And I'd like to show you how orders are done at customer service. Currently, we are working with Samburu order. The order is worth 50 million, 92 facilities. So at customer service, we ensure data analysis is done and accuracy, and processing the orders efficiently. Then we forward it to warehouse.
So you go to the warehouse. Warehouse. Please explain on behalf of warehouse. You can do that.
Good afternoon. So it's about taking through the warehouse process. Immediately the orders are forwarded from customer service. We are now able to generate the picking list, then pack and consolidate the orders now ready for shipment. And the orders are forwarded to distribution. So when they come to distribution, once we are done with loading, we are able to lock the vehicles using the e-locks, they are electronic tracking devices. As you can see from this dashboard, we have several e-locks. As you can see from this dashboard, there are several e-locks on our trucks. Just to show you, outside we have this number of trucks, and these are the tracking gadgets. And we use the tracking gadgets just to locate the visibility of the trucks and also the safety of the HPTs while they're in transit. As you can see, we are able to get the online notifications. So every time a truck is opened or locked, you're able to see the notification online and also the geofence location. So we are able to track the opening and the locking of the trucks at the designated areas that is at the facilities. So this is how we are able to track our deliveries to ensure that they deliver the right facilities.
Thank you. You want to talk about e-locks?
Yes, these are the e-locks. As you can see, these are notifications of a truck that has been opened. Then every time we lock, we also get a notification. You'll be able to see from the trucks parked outside. You'll be able to see they have the fitted e-locks, the tracking gadgets. So this is the dashboard that we use to track the truck movement of the respective deliveries being done by the truckers.
Beatrice, QA.
Good afternoon and welcome to KEMSA. For us, quality assurance is the heart of everything that we do in KEMSA. It's actually what sets us apart from the other suppliers. So for us, we ensure quality right from procurement of commodity, whereby we ensure that the specifications are verified and that they meet the required standards. And during receipt, we also ensure that product is inspected, both pre-shipment sample and full consignment. We have our QA staff that do the inspection. And then we also ensure that our products are tested, both in our internal lab. We have an ISO 17025 2017 accredited lab. That is where we test our commodities. And where we need to have confirmation, we send our products to NQCL. So we've collaborated with NQCL in testing of our commodity. We also ensure that the storage of commodities is adequate by continuous monitoring of the temperatures. All these go downs, we monitor the temperatures. We also monitor the temperatures for the commodity when they are being dispatched to the facilities. So we ensure that quality is maintained throughout the supply chain. That's the nutshell quality assurance.
Do you want to mention about QA in procurement, QA in the warehouse, and post-distribution surveillance?
I think I've just done that. Yes, QA in procurement, ensuring that the specifications are met, and we also have a QA person sitting in every evaluation that is done in KEMSA to ensure that the specifications that were sent out to the suppliers are met during the evaluation. And then during warehousing, again, as I've said, we ensure that the temperatures are maintained by continuous temperature monitoring. Post-marketing surveillance, this we do in collaboration with Pharmacy and Poison Spot. We participate in the post-marketing surveillance activities, and where we have a quality issue and that we need to do internal post-marketing surveillance, then we go ahead and do it as an institution.
So the other thing Madam CS would want to mention is that before we used to be like Nakumat, you needed, we got it. So what we've done is that we used to have about 1,000 SKUs or products. So we have narrowed down, working with the HPT department or the Ministry of Health, narrowed down to 463 products, removing duplications and products that are not required. So I keep saying the procurement plan that we have this year is the best ever. Reason being VTAs, Vital, Tracer, and Class A items account for 91% of the products. And then Class B account for 8%, and then 1% is Class C. So before it was the other way around, it was inverted, we had more of Class C. So that's why you realize that we had quite a bit of stock out here, and there, of course, there are many other reasons as to why we could have had stockouts, but we did voice of the customer, sat down with the ministry HPT department, and narrowed to 463. So availability of products will be enhanced despite the challenges of resources. So thank you.